Most healthcare workers across New York must now have at least one dose of a COVID-19 vaccine, but an estimated 72,000 hospital workers in New York are not fully vaccinated. The statewide vaccine mandate is now prompting fears about potential staffing shortages. Meanwhile, the U.S. now ranks 47th on the world's list of most vaccinated countries. 47th. That's largely due to the 70 million Americans who have not received any shots. Emergency room Dr. Ron Elfenbein joins us now. He's the medical director and owner of FirstCall Medical Center. Dr. Elfenbein, so first of all, let's talk about New York. Governor Kathy Hochul could potentially employ the National Guard and out-of-state medical workers to fill hospital staffing shortages due to thousands of healthcare workers losing their jobs for not meeting the state's vaccine mandate. I note that Dr. Ashish Jha, when he was on CBS Mornings earlier today, said it's still a small percentage nationwide. But what kind of ramifications does that pose if there are medical professionals who remain unvaccinated when you're trying to convince a population which now ranks 47th worldwide in terms of vaccines to get the vaccine when certain medical professionals themselves are not vaccinated?
Yes, I think that's a problem, Vlad, and I think that this is a big problem for New York and for other states as well. I would say that it's unusual regarding the way we treat infectious diseases, that we are requiring mandatory vaccination versus, looking at blood levels and titers of your antibody production. We don't do this with any other infectious disease. Most of the time, if you're a medical professional, before you'll get privileges at a hospital or before you'll be hired, they'll want to see what your MMR titer is, for example, or your TB titer your Hep B titer, to make sure you are in fact immune to those particular viruses. But yet we don't do that with COVID-19, and I'm not really sure why they're so hot to trot with mandating everybody get vaccinated versus saying, okay, you might have had COVID 3 months ago. Why don't we look at your titer levels? Because you're going to run into problems like this. People are going to have religious issues. People are going to have healthcare issues that don't want to get vaccinated. And you've already seen 2 judges have already issued injunctions against New York State saying that they can't put that into effect until October 12th. So it was supposed to go into effect tomorrow, but they've now moved that goalpost twice now because the judges say that it would violate Title VII. So, I think there's a way around this that everybody could kind of get what they need. We could make sure that healthcare workers are in fact vaccinated or are immune to the virus, as much as you can be immune to this virus, and we would not have a shortage. Now, to your point, Vlad, that healthcare workers have to set an example. I totally agree with that. And I find it somewhat reprehensible that people choose not to get vaccinated for whatever reason. I think as a healthcare worker, it's incumbent upon you to get vaccinated and to be fully vaccinated.
Dr. Elfenbein, your clinic provides a supply of antiviral medicine for COVID. Just how is your clinic faring in terms of supply and demand? We have seen surges in cases. How are things going for you?
So we have 2 sites that we do monoclonal antibody therapies at, and we are actually the busiest in the state of Maryland. So the way it used to work was before September 13th, you could just order whatever quantity you needed for that week. You would just place an order online, and you'd get it within a day, possibly 2 days from the distributor, and it would come in a box, refrigerated box, and you could just go right to using it. Now the federal government has taken over that, and they have determined, as of Tuesday of each week, how much each state will be allocated. And then by Thursday, the states have to determine who's going to get how much of each allocation. And we actually have gotten the most because we are the busiest center in the state of Maryland. We get 10% of the state's allocation. But it's been problematic because we are using more than we're getting. And you have to report that at the end of every week. You have to issue a report to the federal government about how many doses you have used. And they have to look at those 2 things and make sure they match up. And if they do, then historically speaking, you'd get whatever you asked for. But now they have cut distributions because they want to make sure that there's an equitable, quote unquote, equitable distribution across the country. But I would argue that it should really be based on need, not on equity. It should be based on, who has the sickest people and who needs it the most, which of those states, and those states should get the most. Now, that being said, 7 states account for about 70% of the use of monoclonals throughout the country. So I think what the Biden administration was trying to do is sort of make sure that every state has enough of it. But to my knowledge, there really wasn't a problem with shortages before they did this. They say that there was a looming shortage, but I have not seen that the numbers that there actually was a shortage. But now we are getting less than we're actually using.
Let me ask you about Pfizer's CEO that says the company is going to submit data to the FDA for its COVID-19 vaccine in children ages 5 to 11. They say they're going to do that in a matter of days. If the FDA approves the data, he says the company will be ready to manufacture the vaccine. Once this portion of the population is vaccine eligible, could we see the page turning on the pandemic?
Yes, I think that's very possible. I think, unfortunately, we've seen a large spike in pediatric cases of COVID-19 this year. This school year, rather. Once school started, we're starting to see some spikes in kids. And since the Delta really became the #1 variant, it's really started to take off. So I think that, yes, this will be another sort of quiver in the or sort of tool in the tool belt, if you will, to keep us as safe as possible and to kind of knock down the number of new COVID cases that we're seeing, because again, a large percentage of those are now pediatric cases. But remember that those kids are not eligible for vaccination. So yes, it's amazing that this will happen, and it hopefully will be a game changer. Just remember, though, that once the data is submitted, it will take the FDA some time to review it and then to either approve it or not. So it's not going to happen tomorrow, but hopefully by early November, we will have a vaccine for kids age 5 to 11. And then hopefully by December, the data will be submitted for kids 6 months and up, and we can potentially look at vaccinating all children, everyone over 6 months of age.
Wow. Dr. Ron Elfenbein, thank you very much.
Thank you, guys.